Hello everyone. Today I will be showcasing Live Longer, a product conceptualized by Dr. Majid with an aim to bring out a hepatoprotective product which can cater to the existing gap in this market. We will look at the study recently published on Live Longer in this presentation and how it helps to explain the science behind the product and also its health benefits with possible health claims. Before I discuss the product, a brief introduction to Sabinza Corporation. Sabinza Corporation was established by Dr. Muhammad Majid in 1988 with an aim for bringing science-based natural products and extracts with a particular emphasis laid on achieving highest quality through biostandardization and science-backed innovation. Today, Sabinza has market reach in all major geographies. We have innovation engine fueled by over 120 scientists and PhDs and a global workforce of over 1,000 people. Innovation secured by 260 IPs, providing platform for strong brands which have become synonymous with innovation and science. Sabinza is a vertically integrated company with farming land of over 40,000 acres and over 6,000 strong force of farmers. Our production houses are GMP audited and we use green practices. Our Payson facility in Utah caters to the formulation needs for dietary supplement industry. So let's discuss the science on Live Longer by looking at the liver and why this product is a game changer in area of supporting liver function. Liver, in my opinion, is a powerhouse of body. This 1.5 kg organ is one of the largest organ and most critical, but also which is one of the most abused organ. Busy it is, as you can see from the role it plays in your life, from supporting metabolism of nutrients, storing energy as glycogen, producing proteins to clot the blood at the site of injury, transporting fat, transporting cholesterol, cleaning drugs and toxins from the blood, and much more. And it does this day in and day out. Every minute, 1.5 liters of blood passes through the liver carrying nutrients as well as toxins. It basically means that in 3 minutes of time, entire blood volume of body passes through the liver. And this happens 500 times a day. So you can see what 24/7 job liver performs for all of us through our life. Liver health can affect our health in many ways and vice versa. Our lifestyle habits, food consumption, family history, chronic health conditions can affect liver in many ways. Liver dysfunctions are also hard to catch in early stages, as most of the symptoms it shows are underlying symptoms for other conditions like abdominal pain, fatigue, weight loss, easy bruising, and so on. Today with Live Longer, we'll be looking into one of the conditions of liver which has become a silent epidemic in not just the nutrient-rich developed nations, but also in developing nations where the malnutrition is more than a common occurrence. That brings us to non-alcoholic fatty liver disease, in short NAFLD, a term which is used as an umbrella term encompassing the progressive conditions such as NAFL, Nash, fibrosis, liver cirrhosis, and hepatocellular carcinoma or HCC. If you see the global data on the occurrence of NAFLD alone, you will note that it already has reached to an epidemic levels. There are more than 20 to 30% population in the Western countries like US and 15 to 20% population in Asian countries that are currently facing this health concern. And NASH or non-alcoholic steatohepatitis is one of the stages which is becoming a growing concern for various reasons. Since NASH has a very close proximity with metabolic syndrome and obesity, one can realize the increasing risk factors for people suffering from these health concerns. The cost of fatty liver health related condition also pose an additional burden on the healthcare system. Now let's have a closer look at how fatty liver health progresses from completely benign state to a malignant state of hepatocellular carcinoma and the stages it crosses through. Keep this slide in mind as later we'll find it very useful while observing the study done using the STAM model. So let's start with NFLD. It's a condition which can have a very benign form with simple deposition of adipose tissue in the liver and is commonly referred as non-alcoholic fatty liver, where there is evidence of steatosis involving not more than 5% of parenchyma, but there is no injury in these hepatocyte cells. Now, another form of NFLD where we see the characteristic necrotic inflammation with steatosis is called Nash or non-alcoholic steatohepatitis. In Nash, one will encounter the ballooned hepatocytes accompanied steatosis and inflammation. This is the stage which we are more concerned. The rate of progression into NFLD is already quite high, and almost 15 to 25% of the population with NFLD can also progress into Nash, and this stage we still can reverse the liver damage. However, if left unchecked, the chronic inflammation in Nash can result in developing scar tissues which initially appear as lesions. Now, studies have revealed that the collagen fibers will start encircling the affected hepatocytes and later replace the soft healthy tissues. Now, unlike the healthy liver cells where the scar tissues are unable to repair themselves and start reducing the liver function, scar tissues block the limit of the blood flow and kill the healthy tissues, and in process create more scar tissues leading to fibrosis. Now there are stages of fibrosis as well as which depend upon the amount of scar tissues and its location. But we won't go into the details, but we'll move on to the next stage, which is the liver cirrhosis, which is reached due to unchecked fibrosis building up more scar tissues in the liver. Now, till the early stage of fibrosis, there are not many symptoms, if any. But as the fibrosis progresses to the liver cirrhosis, one can experience loss of appetite, weakness, exhaustion, weight loss, nausea, abdominal discomfort, tendency to bleed, edema, increase in sensitivity towards different drugs, as well as cognitive decline. Finally, inflammation and fibrosis can lead to hepatocellular carcinoma. In USA alone, there is almost 80% increase in its occurrence in last 20 years and has made hepatocellular carcinoma the fifth most common malignancies in the world. Now, the worrisome part is that while examining hepatocellular carcinoma patients, we also find that they have a high number of metabolic syndrome risk factors. Hence, these chronic health conditions can have significant impact on liver health. So now we know a bit more about liver health and NFLD or fatty liver disorders. So let's talk about the product we want to introduce in this area for managing the fatty liver conditions, Live Longer. Live Longer consists of three plant extracts. Livinol, which is an extract of Garcinia indica, is standardized to 20% of carcinol, a polyphenolic compound. Curcumin C3 complex, which is the most clinically studied brand of turmeric extract, is standardized to 95% of curcuminoids. Now, both Livinol and curcumin C3 complex are made further bioavailable by BioPrin, which is an standardized extract of black pepper fruits. Now let's look at the study which was recently published on Live Longer, which also provides the rationale for this unique combination. Live Longer was studied using STAM or Stellate Animal Model Study, which has some unique features. This study was carried out by SMC Institute in Japan according to the relevant guidelines and regulations of Japanese Pharmacological Society, Ministry of Environment, standards related to care and management of lab animals, and approved by the Ethics Committee at SMC Lab. We will use the STAMP model for studying the progression of Nash into fibrosis stage and factors that can slow down or halt its progression. Now, as mentioned earlier, fatty liver disorders in early stages are very hard to notice, but they are very much influenced by our lifestyle and chronic health conditions such as obesity and metabolic syndrome. We see that the incidence of NFLD increases with the increasing number of metabolic syndrome criteria are met. Hence, the more the conditions of metabolic syndromes are met, the higher possibility of person suffering from NFLD or NASH exists. The STAM model has its unique advantages while studying the NFLD progression to hepatocellular carcinoma. Firstly, it actually replicates the same disease progression as in human NASH. It produces the same pathological features as it happens in human. And it can create the burnt out NASH condition showing the further progression to fibrosis. All this in a timely manner as we will see in the next few slides. We can say that the studies published using the STAMP model have actually shown high clinical correlation. Hence, this model is considered to be very useful in studying the therapies related to the management of NASH, NFLD, or hepatocellular carcinomas. This slide actually gives an overall view of the planning of STAMP model study. So as you can see, the fatty liver conditions are first induced in the diabetic mice by a fat diet. This is done in the first 4 weeks of the life cycle. By the 6th week, the NASH baseline is reached, and at this state, the test substance or the vehicle or control is administered for the next 4 weeks. In this model, we'll be seeing how Live Longer can actually help to slow down or inhibit the progression of NASH into the fibrosis stage. This study model uses several key parameters to oversee the progression of NFLD disease. One of the key parameters is NAS or NFLD activity score, which is obtained by histological examination of liver tissue. This examination revealed that Live Longer showed significant decrease in the fatty liver, which later also affected the NAS score, where results showed that there was 37.5% decrease in NFLD score in Live Longer group. In our further study in the fatty liver, by using hematoxylin and eosine staining, we could look into the fat deposition in the cells, which helped to reveal the steatosis, hepatocellular ballooning, and inflammatory cell infiltration. 75% of animals in the Live Longer group did not develop the hepatocyte ballooning, and also the inflammatory foci was reduced with the treatment groups of both curcumin as well as with the Live Longer. Now, as mentioned earlier, as the disease progresses from fibrosis, the lesions are replaced by hard tissues made up of collagen. As to understand the effect of Live Longer, the liver cells were treated with the picrocereus red stain to observe the collagen deposits. as well as the fibrosis area. Our results show that Live Longer reduced the fibrosis area by 30%. Another important biomarker for the progression of liver fibrosis is hydroxyproline. It's an amino acid which is majorly found in collagen. It is now considered as a biomarker for studying the progression of fibrosis in this model. Lower content of hydroxyproline basically shows the protective effect of Live Longer against the fibrosis. In our study, we also looked into the gene expression of TGF-beta and collagen 1, both showing a downregulated expression showing the reversal of fibrosis. Now coming to the inflammation in liver. Several key biomarkers expressing the liver damage were also studied in this model. The biomarkers like tumor necrosis factor, NF-kappa B proteins were also analyzed in the liver tissues and were found to be significantly lower by almost 1.4 to 1.6 fold. Further, the antioxidants like glutathione peroxidase or superoxide dismutase in Live Longer group are also found to have higher levels. Similarly, mannaldehyde, which is a biomarker for the lipid peroxidation, was found to be reduced, showing the protection against the oxidative stress. Now, in the STAM analysis, also looks into several other biomarkers, such as adiponectin. Now, adiponectin is a hormone regulating the glucose level and fatty acid breakdown. Usually we see adiponectin levels reduced by 20 to 40% during the progression of Nash. Similarly, fibroblast growth factor or FGF21 is also found to be elevated in Nash and reflects the fat accumulation in liver. This STAM analysis also looks into the liver enzymes such as alanine aminotransaminase or ALT. The ALT enzyme levels also show the inflammation in the liver. All these biomarkers are extensively discussed and studied in the research article, which I will be later showing you. So as you see in this presentation, with the STAM analysis, we are able to probe into the hepatoprotective activity of the combination as well as the constituents of Live Longer, namely livinol and curcumin C3 complex, which helps to observe the synergistic effect and also define the rationale of this combination. As you can see, livinol significantly decreased the liver hydroxyproline, showing downward trend in progression of fibrosis. Curcumin C3 complex, on the other hand, reduces inflammatory markers like NF-kappa B and TNF-alpha in addition to halting the progression of Nash into fibrosis stage. Livinol itself, like its individual components, shows reducing fibrosis progression and reduction in the inflammation in the Nash stage of NFLD. Hence, with this study, we can conclude that Live Longer can help to manage Nash condition in the liver by reducing the hepatocyte ballooning, a characteristic of Nash condition, reduced deposition of collagen in liver, which shows the progression into fibrosis, at the same time reducing inflammation and oxidative stress. Live Longer showed significant reduction in Nash severity compared to the monotherapies and suggesting a synergistic effect of the constituents of Live Longer. Now the constituents of Live Longer have also got a very good safety profile, as we see from the studies done on livinol and curcumin C3 complex. Livinol has gone through a battery of safety studies, including acute single dosage studies, 28 days subacute, 90 days subchronic toxicity study, as well as reproductive toxicity studies. Curcumin C3 complex is actually the only curcuminoid in the market which has already been reviewed and acknowledged by US FDA for its GRAS status. Live Longer is also a subject for a randomized double-blind placebo-controlled study for evaluating its benefit in the Nash condition without the liver cirrhosis. This study is being currently conducted in 2 sites, both in India and United States. The study done on the STAMP model on Live Longer has been published in the Open Access Journal of Nature, the scientific reports, and is available online. The safety profile of Garcinia extract used in Livinol has also been studied, and the study reports have been published in toxicology reports. The innovative approach of managing fatty liver disorder using Live Longer and Livinol also helped to obtain the IP in several countries already. So from this presentation, you can see that Live Longer can be a game changer in the hepatoprotective product range by filling the gap existing in the market related to the fatty liver health management. This combination provides a hard evidence with the STAM analysis about its synergistic benefit in the liver protection. I thank you for your time and your interest in our product, and we look forward to receiving your questions and feedback. Stay well and stay healthy.